is Caitlin Edwards, and for my second case study, I chose to do the topic of aneurysms for our DMS 4410 class. I'm going to start by giving a quick introduction about our patient. He is an elderly gentleman who presented himself to the emergency department complaining of some nausea, vomiting, and severe lower abdomen pain. He said that his symptoms started early in the morning and then progressively got worse as the day went on. When the patient got to the ER, they took some of his vitals and they found that his blood pressure was a lot higher than what that patient normally says his blood pressure is. So after the physician assessed the patient, he ordered some imaging exams. The first one he ordered was an abdomen pelvis CT to kind of rule out these different pathologies. So it could have been a calcified cyst from an old hematoma, an iliac artery aneurysm, bladder wall calcification, or a pelvic abscess. So after the CT was done, the results came back and confirmed that there was bilateral common iliac artery aneurysms, the right measuring much larger than the left, a little bit over 5 centimeters. So we can see here, this is the right, and then here's the left. The ER physician wanted to further assess the vessels, so he ordered a vascular ultrasound. These images show that there is indeed a dilation of the right common iliac artery to the extent that emergency intervention was needed. They diagnosed the patient with isolated iliac artery aneurysm. So what isolated means is that the iliac artery itself is dilated, but if you come over to this transverse view, you can see the distal abdominal aorta, and it is still a normal size. So isolated means that only the iliac artery was distended. The standard protocol for scanning aneurysms is to use color Doppler imaging, and these pictures show the typical turbulent flow that is seen in aneurysms. I wanted to add a quick definition of what a turbulent flow is, and is defined as the chaotic flow appearance where the fluid is coming out of a tight spot into a widened area. So here you can see the normal laminar flow of a vessel, and then when it gets into a widened area, you can see that the blood kind of travels in all different areas, which is why in these color Doppler images we see flashing of red and blue, because the direction of the blood flow is kind of going all over the place like shown in this image. So what is an aneurysm? An aneurysm is a dilation of the blood vessel, creates that bulging appearance, occurs because of a degeneration and weakening of a vessel wall. A large aneurysm can burst, which causes massive internal bleeding and can be very life-threatening. So to break it down a little bit more specific to what our patient was diagnosed with, an isolated iliac artery aneurysm. They have a high rupture rate. The isolated iliac artery, where it only affects the iliac artery itself, is very uncommon. Usually there will be a distension in the iliac artery as well as the distal abdominal aorta. So the isolated iliac arteries aneurysms account for all less than 2% of abdominal aneurysms. The most common iliac artery aneurysm is in the common iliac artery. So they have, you can kind of see a little bit in this picture, there's the common iliac artery, and then it branches off into the internal and the external. But 70% of iliac artery aneurysms happen in the common iliac artery up here. And in most cases, not most cases, in 30% of cases, it happens bilaterally, so it will happen in the right and the left. So some typical measurements. So the iliac arteries are considered distended or ectatic when the diameter measures greater than 1.5 centimeters, and they are considered aneurysmal at greater than 2.5 centimeters. And our patient's was measuring around 5 centimeters. So it definitely was considered an aneurysm and not just distended. So what causes aneurysms? Atherosclerosis, which is the hardening of the arteries, hypertension, infections, congenital weakness of the artery wall, which usually is presented at birth, connective tissue disorders, trauma or surgery to that specific area. And you're more at risk if you're older than 60, male, have high cholesterol, high blood pressure, or smoke. So the symptoms that isolated iliac common artery aneurysms present is pain at the aneurysm site. So for our case study patient, it was that lower abdominal pain. This pain is usually because the artery is so distended that it's compressing on surrounding structures or vessels. If the aneurysm does rupture, it is very acute abdominal pain, just like our patient was feeling. I feel like he was on the border of it rupturing, so that's why he was in such pain. Definitely will experience shock if there's a rupture. In one of the resources that I was studying for this case study, it says that patients may experience a sharp ripping sensation, and that even if the pain subsides, emergency medical attention is needed to help with that mass internal bleeding. And oftentimes, aneurysms are actually asymptomatic until they are severely dilated. So for our case study patient, in most cases, the iliac arteries are typically asymptomatic if they're less than 3 centimeters. So there's a few different exams that can be ordered to help diagnose some aneurysms. So there's a physical exam, palpating, see if there's any mass that the physician can feel, ultrasound imaging, a CT angiogram, magnetic resonance angiogram, or angiography. So pretty much all across the board, a lot of different tests that can help diagnose this. And like I was saying, since aneurysms can be asymptomatic sometimes, they are usually found as incidental findings on exams for other reasons. On this image, you can see this is another example of an isolated common iliac artery aneurysm. You can see the aorta coming down, and as it bifurcates, aorta is normal sized, and then you see that this left common iliac artery is dilated to the extent that it is considered an aneurysm. So there's a couple different things that you can do for treatments. It just kind of depends on the size of the aneurysm. If it's less than, I believe it was the 1.5 centimeters, or to the extent where it isn't critical to help stent that aneurysm, the simple measures are to basically maintain your health. So quit smoking, control blood pressure, maintain blood sugar, lower your cholesterol, and maintain a healthy weight. If the aneurysm size has increased to the extent that there needs to be emergent care taken, they can surgically reconstruct it and using endovascular stent grafts. They use these grafts if the aneurysm is not ruptured. It is less invasive, and what they do is they will go up into the femoral artery and go up to the common iliac, and they have their guide wire come up into this area. They inflate a balloon that will leave this stent in that space, So they'll deflate the balloon, the stent will stay, and then they'll retract their guide wire, and that will stay and help keep the shape of, so that the aneurysm does not extend or have a greater risk of rupturing. If the aneurysm does rupture, they can't get to it fast enough, then they have to do what's called an open procedure, and they have to go in and repair the vessel itself. So it's definitely more invasive for the patient. So for our case study patient, kind of specifically for the isolated iliac artery aneurysms, typically if it's less than 3 centimeters, they'll just have them do a 6-month follow-up with imaging, just making sure that the size is staying intact. If it's greater than 3.5 centimeters, they are at greater risk of rupture and will require intervention. So for our case study patient, because he was in so much pain, and because of the severe findings from the imaging exams, the patient was rushed to an emergency procedure to place one of those endovascular stent grafts. It helps hold the structure of the vessel again to prevent any further expansion or rupture of the vessel wall from happening. And this is my works cited. Thanks.